We're talking about a medical condition now which affects at least 1 in 10 women, but just isn't spoken about enough.
Polycystic ovary syndrome, or PCOS, alters the way the ovaries function, which can lead to both physical and psychological symptoms. They can often be hard to spot and even harder to manage.
One in 10 women of reproductive age worldwide has polycystic ovary syndrome, or PCOS. But here in the Philippines, 1 out of 5 Filipinos may have it, and most of them don't even know. PCOS is more than just missed periods. It's about hormone imbalance, infertility, weight struggles, and even mental health. I'm Luna, and this is my health campaign. PCOS, let's talk about it. Our goal is simple: to raise awareness, promote early detection, and push for access to proper diagnosis and care. Here's how we plan to make a difference. First, awareness campaigns. Through educational seminars in schools, workplaces, and barangays, we aim to share what PCOS really is, its symptoms, risks, and management strategies. Next are accessible screenings and healthcare. By partnering with local health centers, we can provide free hormonal testings and OB/GYN consultations. Early diagnosis can prevent serious complications like type 2 diabetes and heart disease. Lifestyle support programs. From government-backed nutrition guides to free fitness videos, we advocate for PCOS-friendly wellness. We also plan to develop a meal plan ebook and distribute it in community health centers. Lastly, online engagement. Through social media reels, real-life stories, and myth-busting infographics, we can normalize the conversations around PCOS, especially for young women. PCOS is not just a woman's issue, it's a public health issue.
My hair grows all on my neck, the sides of my face, my chin, my back. I feel more of a man than I am a woman.
Rohini, how long did it take you to get a diagnosis?
It definitely took me a while.
Yeah.
My symptoms really kicked in about 15 years ago. I was at uni, kind of living typical student life, and I got really bad acne. It was like the lower half of my face, really painful. I was losing chunks of hair from the top of my head, and I noticed that the gaps between my periods was getting longer as well, and that made me really anxious. I just didn't feel good in myself, and I would often stay in my room for days at a time, feeling really, really anxious about these symptoms and really self-conscious as well. And at the time, I put it down to I was just stressed about exams. I thought that was the problem. But when I left uni and the symptoms still kind of continued, my mum said, "Okay, could it be PCOS?" I'd never heard of PCOS, and obviously, being 18, I don't really want to listen to my mum. But mums are usually right, and with her help, I was able to get that diagnosis. It was difficult at first to realise that all of those symptoms were connected, that they did come under this kind of PCOS. But I was trying to fight that diagnosis. I didn't really know about it.
Yeah.
So
It doesn't define me. PCOS doesn't define me.
PCOS doesn't have a cure, but it can be managed. With knowledge, support, and access to care, we can empower Filipinos to take control of their health. Join me in spreading awareness, share this video, talk to your friends, ask your barangay to host a PCOS seminar. Together, we can break the silence, one conversation at a time. This is PCOS, let's talk about it, and the time to talk is now.